Have you heard of this term avascular necrosis? We have seen that post-COVID, a lot of young males are coming to us with avascular necrosis of hip joint. So what is this condition? This is a condition where the blood supply in your hip joint decreases. Now let me show you here. See, this is a model where we have this hip joint. So this is your thigh bone and this is where the hip joint will be formed. Can you see this blue area? This is our joint. Now, for any joint to be healthy, you need a lot of blood supply. And in avascular necrosis, the blood supply to this part of the joint will decrease. Because of that, what will happen? All your cells, all your muscles there will start degenerating. The joint will become very fragile and eventually the joint space will start decreasing. There will be cartilage loss. The fluid can also get accumulated into the joint. The muscles become stiff. And so, patients can present with us with symptoms like pain in the hip joint, stiffness in the hip joint, inability to sit on the floor, inability to get up from sitting position, restriction of the joint movements, and they show pain in the groin area, in the thigh, in the buttock area. So if you have any kind of symptoms, you make sure that you are going to get yourself checked. Now, how to do confirmation that this is avascular necrosis or some other pain condition? First thing is, do visit your doctor. They will take your history. In history, sometimes we will identify that what is the cause. Then we do certain examination tests, and these tests are to examine your hip joint, your knee joint and your spine. We see how is your hip joint mobility, what is the restriction, what is the range of motion, and after that we do certain investigations like an ultrasound investigation or MRI to confirm whether it is avascular necrosis or is it because of arthritis or some other disease. Now after once we have confirmed, we make sure that we give you a holistic approach, we give you a multidisciplinary modality to get rid of this pain. Like I was mentioning, post-COVID young males are coming. So young males, we cannot make them undergo any kind of surgery. Their daily life is affected, their work is affected, their quality of life is deranged. So we give them a holistic approach. Now what we do here is, because the blood supply is reduced in these part of the joint cartilage will start decreasing. So our whole aim is to prevent the damage. And how we do that is with help of few minimally invasive procedures like the cell therapy or some needle injections, prolotherapy, radiofrequency ablation treatment. These are minimally invasive procedures which are done in operation theatre by a pain physician, by a trained doctor, because these are technically very skilled procedures. It hardly takes 15 to 20 minutes but has to be done in a proper way. We do it in operation theatre under fluoroscopy machine or ultrasound machine, and then we give them certain kind of lifestyle modifications, some anti-inflammatory tablets and certain exercises and lifestyle modification. So this is going to heal your hip joint pain or avascular necrosis over a period of time. And you need to give a frequent checkup in 2 to 3 months to see how you are healing. So once this is done, you will get rid of your avascular necrosis of hip, because we are prolonging the damage. And eventually in few years, you also need to get yourself checked that how your joint is doing, how your muscles are. So we give a whole protocol for avascular necrosis of hip. So if you are someone who is suffering with avascular necrosis of hip, you don't need to suffer. Do visit us, because we have been treating a lot of young patients post-COVID with this condition, getting very good results.